I can't press record.
Okay, I got it.
Okay, you're good?
Yep,
Yeah, I
I'm
can't
good.
record on mine. Okay. Yeah, so if you're tuning in right now to this video, this is basically just something we came up with. We're going to do a dual interview. I'm Joel Youngkins. I own a private training facility in the Youngstown area. Train a lot of athletes and general population people. And Caitlin, she's a physical therapist as well as a triathlon coach. And for just this interview that we'll do here, we'll probably just speak on her as a physical therapist. Maybe in the future we'll kind of do this again as, you know, she could put on her like triathlete hat or something.
Yeah.
But Caitlin, she owns her own place now in Canfield, and where she, I don't know if you want to elaborate on this part.
Yeah, so I am right behind the Blue Wolf here in right between Youngstown and Boardman, Canfield area. And we primarily focus on a mix of physical therapy as well as coaching athletes. So we get a really cool, intricate mix of athletes that come to us like with injuries or who just, want to move better, feel better, be stronger, and race and perform better. So we do a little bit of everything here. It's pretty cool. We got like a small little 800 square foot facility where we've got a little gym area as well as a treatment room. So a lot of stuff that we can do.
Yeah, awesome. And for those of you who might not know, me and Caitlin, we've been friends for a while. We went to undergrad together and kind of just became probably better friends after when we both got into the real world and kind
Yeah.
of probably connected more then. And, my coaching philosophy as well as hers, we've always kind of aligned with, our belief system. And I think we're just always so busy. Like we always talk about doing things like this together, but it's like, yeah, we got to get around to doing this. And well, we kind of eventually just made that happen after like 7 years or something. But
Yeah.
so we're going to try to start doing some stuff like this, some more collab, projects. So basically what we're going to do is we're going to do a dual interview. We're going to try to get through 3 questions. I have 3 for her. She has 3 for me. And um, I'll let her go first as far as answering her question. So
All
ladies
right.
first. So
Hit me with
ready to
it.
start these questions? Start ripping them off here?
Yep.
All right. So I'm coming up this May of 21. I'm coming up on 10 years of chronic low back pain. And I've had to work around a lot of issues, with myself. And I kind of know like what the kind of checklist I need to do as far as like keeping myself healthy. I've worked with a few low back patients as well, but like you're the real expert in this kind of topic, and I really want to pick your brain a little bit of like, what do you think? Like, are there any like best ways to treat chronic low back pain for people? Because I know it's like kind of an epidemic for people, and everyone kind of like has some sort of, it seems like at least 50% of the people. So what's your take on all this? And
Oh, 100%. So if we're talking about PT in the clinic, low back pain, spinal pain, and discomfort is the number one thing that most of us as physical therapists see. So it's really, really common. So anytime I get a back patient, like the first thing we start with is, obviously a rundown of questions and answers, but it's just kind of like what provokes their pain and what makes them feel better or worse. So I find that with backs, one thing that they hate is prolonged positions. So they hate to, just stand and do the dishes or sit at a desk all day or just
yes.
anything, even sleeping. Like sometimes my clients will say, oh, I feel worse in the morning. Well, yeah, because when we slept, that was the longest prolonged position we were in. And lucky for the fitness gurus like us, what backs do like is they like movement. So it's really, really important as, prescribing exercise, whether it's in a PT or a performance prep facility such as you, is that, backs like movement. You'll find that even for any kind of back rehab program, if we're talking about the clinical space, we're prescribing like a walking program, walking, cycling, swimming, just anything that's going to create some movement for the individual. It's
Gotcha.
when it's kind of when the client thinks that their back pain is so limiting that it becomes self-limiting and we stop moving and then it gets worse.
Right. I totally agree. Just from like my personal experience, when I first hurt my back, that was like the first time I've ever experienced back pain like that. And
Right.
for a couple of years, it kind of like was always in my head, like, oh, I can't do what I used to do. And then I kind of just got over it one day where I was like, like what you're talking about as far as, moving. It's just like what I tell people is it seems like if you treat your back like a baby, it stays a baby.
Yes.
It's like you got to like get them out of that mindset as like quick as possible.
Right. And then so if we're like looking at, so if I had to break it down in like three different ways of what we look at when we look at back pain, it would be mechanical. So like what's going on with the system and why does it
Yeah.
hurt? And then we would look at more like the psychosocial side of things. So there's all kinds of things out there now with like depression and anxiety and how that can correlate to the chronicity of pain and being in pain. And then, the third thing is just looking more at, what's going on in the nervous system and just like the way the client moves. So if we break down, and you always hear people say, if you have a strong core or if your back hurts, you need to have a strong core. Well, the inner workings of the core are really cool because you actually only have one muscle that connects from the front to the back. And this muscle works as a feed forward mechanism. So before we even move, that muscle is like, oh, I've thought about movement. I need to stabilize the spine.
Hmm.
So as long as we can reteach the client how to stabilize their spine before we move, it's a really good protective mechanism.
Yeah,
So
awesome. Good stuff.
yeah, and I think that you're familiar with like the McGill exercises.
Hmm.
The McGill Big
Definitely.
Three. Those are always a really good go-to. And then just any kind of like retraining the core to stabilize the spine as well as movement. And that's kind of like the go-to for back pain.
So like people with low back pain, do you think that like is there hope for everybody if they have back pain? Like
I think so.
is it
And
the end?
I think, I've had a patient come to me and, you know, saying about how bad her back hurts. And, you smoke 2 packs a day and you drink a 12 pack of beer. Like, I'm probably not going to fix your back pain. But
Yeah,
if the patient is, healthy and taking care of themselves and we can kind of clear that nervous system, there's definitely hope.
awesome. Well, good stuff. I think definitely someone should be able to take something away from that. I know, like, there at least has to be light at the end of the tunnel, I think, for people.
As long as it's not a train.
Yes.
Okay. Are you ready for my first question?
Yeah, let's do it.
All right, I just want to talk a little bit kind of like the why and how to
Okay.
your physical prep approach with your athletes. So, like, what do you, I know it's such a general question, but what kind of approach do you take to getting your athletes stronger? And then how long does it take them to start to see results?
So, like, when you talk about strength and like getting athletes stronger, it's actually like in theory a really simple idea.
Hmm.
And once you kind of know like kind of the rules of the game and how to kind of apply all of this, like, it's pretty simple to like make happen. And I think a lot of people just think like all we do is just strength training, but that's like just one part of it. But it's a
Yeah,
huge part because like without being strong, like nothing else falls into place. Like it's kind of like strength allows a bunch of other doors to open up for athletic performance. So it's very important that you don't kind of like neglect this or screw this up. Um, so what we follow here is like as far as our programming approach is we really respect the law of or the principle of progressive overload. So what we do is we focus on either adding volume or adding intensity. So volume would be like the sets and reps, the total
right,
amount of work you're doing. The intensity would be like the weight you have on the bar or just like that you're doing. And you want to just slowly keep bumping those up all the time. Because if you don't, then you just plateau and like your body doesn't see it as like a stress.
right.
Because we know like training is just stress. Like we're just playing a game of stress with your body. Like we're going to stress it a little bit and then we're going to adapt. We're going to stress and then adapt. So whereas like if you don't follow that rule and you just like keep going in and benching 135 pounds, your body's going to get good at that and then it's not going to improve. So I think most people know like that's a thing. Like it sounds really simple, and a lot of people
Right.
do this, but after a while they kind of like neglect it and they're like, oh, I'm in a plateau, but they're just not manipulating variables properly. So, we follow that and then we'll focus on using the squat, bench, deadlift, and row variations for not just our athletes, but our general population as
Yep,
well.
say those four again.
The squat,
Squat.
bench, deadlift, and then all kind of like rowing variations.
I like that.
So I think a lot of people, when you first say that, they think elite athlete, like lifting all kind of weight or like this extreme power lifter. And it kind of like some people like maybe get like, turned off by that.
Right.
But what we have to think of is we're not just like, excuse me, we're not just jumping in and just throwing a bunch of weight on the bar. So there's a ton of variations that go along with this. It's just the squat's just intended to develop lower body strength because we're designed to squat.
Right.
We're all able to press something. We're all able to pull something off the ground. We're all like we're designed to row, like to pull something towards us. So we're just training movements that our body's designed to do, and then these movements will carry over and help you with your athletic performance as well. So we kind of use those like in its variation, and honestly, like 99 out of 100 times when we get a new athlete or client in our facility, they won't even touch a bar the first month.
Yeah. I was really impressed with that when I was coming to JYT. I felt like I learned quality movement before I used that kind of movement to train my body to be able to lift weights. Does that make sense?
Yeah, 100%. And that's part of the reason why we do that. The other part is like, we want to just keep like throwing a stim every time you train. So like,
right.
If you think about it, like, like if this is like your red line, like where, like this is like your max output for the day, you kind of want to take it like right to like that red line, but you don't want to go blowing past it.
Right.
So like you always want to think like push that red line and it keeps like bumping up over time. So strength is really just a slow and steady approach, kind of wins this race. You just want to keep making small progress every week. And when it comes down to, excuse me, the pile when they're getting to me, you can kind of see results either right away as far as like getting stronger. And that could be weeks to a couple months to where the client really starts to feel their body change. But I always say like, you want to get in like at least a good year of training, of like hard training. And then that puts you like in this whole other ball game of training.
Yeah, I like that.
Really
like results. Looking at the long-term approach for success, for sure. I always think that's the best interest in the client too.
100%. And really, that's the only way to do it. If you rush strength, you're just asking for an injury and you're asking for, really stagnation in your training. So it's something you want to train, really all year long. You don't want to like neglect it.
I love it.
Is that good? You want to touch on anything else?
Yeah, no, that's perfect. I think that, I think we'll touch on that more later.
Yeah, and that's like one of the topics, like, man, we can cover it really simple, or we could talk about it for about 2 days straight. So.
Oh yeah, without even stopping.
Yeah. So you ready for my next question?
Yep, shoot.
All right. So a lot of people, they, talk about like, how do athletes reduce injuries or just people in general? And like everybody always thinks it's just stretching. Like, oh, they need to be more limber. They should do more stretching. And like, is that true? Or like what key factors do you know in your world as far as like what can help somebody stay healthier as like an athlete or just like a fitness enthusiast?
Yeah, so like I think that's such a good question to follow up with exactly what we were just talking about. Because I always say like quality movement equals quality training. Okay? So if we're moving well, we're going to train well. And if we're able to move well, we're going to reduce the load and the forces of injury that are acting upon us. So, I mean, I'm 100% with exactly what we were just talking about, like taking a long-term approach, you know. Like we coach a lot of athletes that want to do Ironman, or I have patients that are injured from attempting a race too soon, or, you know, just having a chronic overload. And it's just like, we'll take running for example because it's easy to talk about, but just running isn't going to make you a stronger runner,
Right.
you know. um so my best thing and the way to like avoid injury is just to learn quality movement, whether like I send clients to you or you send them to me if they've been injured. It's just like being able to take the person and detect early on what might be going on and early intervention. And that's
Right.
something that, like, in the scope of today's healthcare model is like people just don't know and they're not educated on where we can go for quality movement training and for quality body work as well. So, like, you know, my practice, I don't take any insurance. I'm 100% in the cash-based realm. Same with you, Joel. um like you can use, if you have a health savings account or a flexible spending account, like if you have money already there, you can use it towards personal training, you can use it towards physical therapy, and you can detect early on if something's not feeling right and you can get that looked at by a professional. I think too often, you know, we just wait. I love to give the example of like beating your thumb with a hammer. So if, you know, you hit your thumb with a hammer and you do that over and over again, you're going to see that your thumb is red hot and swollen and bloody. You're going to protect it. But when it's things we don't see, like, oh, maybe a little kink in my neck or a little bit of back pain, we wait until the train's off the tracks to get it assessed. So
Right.
I feel like there's always a way to, you know, perform and move well, and then there's probably always a way to perform and move better. And even just getting professional help on that before, you know, before it's too late. The early detection and early intervention goes so far.
Right. What would you? That's kind of want to piggyback on. Like, maybe I've been hearing this a lot lately. Is like, what's your thought on like, is stretching good enough?
So I'm actually not a big stretcher. I have an article with Training Peaks coming out on that soon. I always say we need to stop stretching and we need to start mobilizing, because a lot of times when we have tension or an injury to a tissue, we don't need to necessarily make that injured tissue longer. We
Right.
need to heal the injured tissue. So whether we do like some mobilization techniques with a lacrosse ball or dry needling or some deep tissue work, a lot of times like we don't actually need the tissue to be longer. I like to explain it like a garden hose, okay? So if you're washing your car with a garden hose and the hose kinks, well, are you going to stretch the hose or are you going to get the kink out? You're going to get the kink out. So a lot of
Hmm.
times, you know, especially for my profession, looking at runners and triathletes, we don't need very much motion to be able to do our sport. But we need healthy tissue because we need the tissue to be healthy so that we can load it.
Right. Like, I always think like stretching has a place,
It does.
but it's like a really small place.
It is.
You know, like,
Well,
and then
and
kind of going percent on the injury, like if you have like a strain, there's like a tear in your muscle, like the fibers are tore. Like, let's not keep trying to pull on that tear either, I think.
exactly, that's what I always say. I'm like, you don't need impaired tissue to be longer. You need it to not be impaired.
Yeah,
And
yeah, yeah,
that's
100%.
where, like, as a physical therapist, the hands-on, the manual therapy, the dry needling I can do is really helpful. And then we send them to a place like you, and their tissue is healed, their tissue's in its optimal alignment. Now let's get it strong and let's
Right.
make that tissue perform. So it just
Yep.
comes back to quality training, quality movement.
Yep. 100%. Cool.
Yeah, I went on a
Uh,
soapbox there. I could talk about that all day.
yeah.
Are you ready for
Bring it
question
on.
number 2?
Bring it on. Let's do it.
All right. So this is something I kind of struggle with. I mean, not so much personally like myself, but like with clients that come to us this time of year is goal setting. Like, is this
Yeah.
because we, you know, we take clients all year. This is the time we, you know, try to establish the majority of our roster for the next year of our coaching athletes and whatnot. But do you
Yeah.
find that this is a time of the year for you and your clients where you discuss goals, look at weight loss, weight gain goals, or do like a year in review? How do you go about just anything, different at the end of the year?
I would say our athletes, we usually touch on this stuff like after their season is done. So like if they have like football athletes, like when they come back from football season, we're talking to them like, hey, how did the year go? What's your focus for next year? Things like that. We'll try to talk to the parents as well. So athletes are kind of more based on like their competitive season. But even with our general population and our athletes, like those are kind of conversations we're having all year long with them. So like in our
Yeah.
coaching, like we don't just coach them like how to like do this stuff, but we try to work with them more on like a personal level. Like, hey, how's everything going? Like it's always like constant check-ins with them. And we usually
Gotcha.
just kind of do this by like casual conversation. So I don't really set something up where it's like, hey, like this is it's December 16th, today's your day to like, let's talk about goals. Um, I personally don't do that, but we kind of also do a lot of like short-term goals as well. So like on their program, I'll have like 3 goals they could put down for like the month. And if they want to put 1, 2, or 3, whatever, they just put their goal and then there's like an arrow and it says like the action step. So like I just have them write down what's their goal and then like what are you going to do about it?
Oh, I like that.
So then every time they get their program here, they'll see their goal that they wrote down for themselves. And it'll just kind of be like constant reminders. So we try to make it more like interactive where like we're always focused on the goals.
Yeah, I actually read an article over the weekend and it was about like communication, and it said that the best kind of, it was like an article on like the psychology, behind the coach athlete, and it was talking about the best way that they respond to like achieving their goals is with consistent check-in from their coach. So it's kind of
Yeah,
cool
that's
that
kind of what we
that
try
you
to
say
do.
that.
It's
That's
like,
exactly what you do.
and some of it's just like, kind of the art of coaching. Like you try to build like the client walks in, like you have to kind of like establish right away, like what kind of mood are they in today?
Right.
And if like something just looks off, like we better like start kind of like not picking too hard, but it's like, hey, everything going okay? Like, sometimes they'll say no. And, those are moments like, hey, I'm not going to pry, like, I'm not going to try to get in your personal space, but like, are you good to train or like, are you going to be okay? And if they're like, yeah, I'll be okay. And I just know something's going on that just they're bringing in with them, then we try to redirect them towards, okay, well, you're here now. Let's just focus on your workout and like just block everything off like that you had going on before you came in here. So we do try to do like a lot of redirecting, like in a healthy way. And then
Yeah.
also just kind of like talk to them like you and I would talk like as a human being. So,
Right.
um, just kind of talk about like what motivates them and like why, not so much, you know, what their goals are, but like why their goals are that as well. Like, so there's some psychology going on with it as well.
For sure. I like that. I like too that, those
Did I
short-term
touch
goals.
on that?
Yeah, it was perfect.
Yeah. Yeah. Okay. I don't know if I was going somewhere that the
Well,
question
I
wasn't.
think I want to touch on one more thing that you said though, is like I think it's really cool that, you look at, of course, taking like the long-term goal and then breaking it down into shorter, more attainable goals. I mean, I just think that's so important for the athlete psyche, so we can like see that we're making progress, and even
Right.
having them feel invested in us as their overseers, like, okay, well, our pain has reduced a little bit, or we have gotten a little bit stronger, or we have, seen weight loss or weight gain that we want on the path
Yeah.
to an ultimate goal.
And you kind of just made me think of something else. Like what we'll try to do too is like as they're going through their training, we'll
Yeah.
kind of talk about like say if something like just really good happened in like their program and their training, and I'll kind of explain like, look, this is kind of why this happened. Like
Right.
this is how we got to like from this point to this point, and if you keep doing this, it's going to get you to this point over here.
Yeah.
So like you kind of have to like break the training down because a lot of people are like pretty inquisitive. Like even though like they hire us as coaches, like they're still Googling stuff or they're
Oh,
still
for
on
sure.
Instagram. So they're always coming back with questions. So it's like they are curious to know because they just hear a lot of like
Right.
noise. So
And I
you
think
know,
that comes down to, the clients that we work with, they're invested and they give us their two most important things, their
mhm.
time and their money. So we got to stay sharp too.
Yeah, 100%. So where are we at? Am I on asking you your third question then?
Yep.
Yeah. Okay. So I guess you can answer this with like either like your PT hat or your triathlon coach hat, but like what's like the most alarming thing you see in your profession that like makes you concerned as like a coach or a physical therapist?
I think the most alarming thing that I see, it's such a good question. Honestly, I would say it's just how resilient people are. Like
That they are or they're not?
that they are.
Okay.
And it's kind of a different approach, right? So I was like thinking about
That
this
is
question.
alarming or it's not alarming?
So it is alarming.
Okay. Okay.
So, I could sit here and
I know
say,
where you're
well, the patient that
asking.
smokes 2 packs a day and drinks a case of Coors Light come to me and they want to get better. And, it's like, well, you're probably not going to get better. But in today's health and society, I feel like that's just way too common. And so, kind of looking at it from a different perspective is like just how amazing people are. So, I always say, as a coach and a physical therapist, it's so much easier to hold somebody back than it is to push them. Okay. Or I had that backwards. It's so much easier to, wait, let me think how I want to say it.
I think
It's,
you said it right the first time.
yeah, it's easier. Yeah, yeah, yeah. That's perfect. It's easier to push somebody than to hold them back. So that's how it is. The second time. So you
Yeah.
get this client that's not motivated at all, and it's easier to, have them do some small movement or, something that might be life changing for them. But you get these
Mhm.
athletes that are so determined and resilient, and, you're kind of like putting the reins on the horse all the time. And so as a physical therapist, like I feel like I'm constantly troubleshooting and trying to, hold these athletes back. And it's not so much an area of concern, rather it is just like awe-inspiring. I've seen patients who have said they might not, be able to walk without a limp again, like go and run marathons, or patients who, have lost a leg. I look over and they're swimming beside me in the pool. And it's just like, if I had to pick the most alarming thing, it was just like what these people can overcome and how driven they are to do so.
And almost like it's like could be alarming that so many people don't even realize that about themselves.
Right,
That
right.
could be like the alarming thing.
Yeah, and it's almost like I have a client right now, and this poor thing, she's been injured for 2 years, maybe even a year and a half.
Hmm.
Just every single step of everything that she's going through, she has done exactly right. And
Wow.
it's just like sometimes I sit down and I'm like, God, I need to buck up, like, because these people that I work with are badass. And
Yeah, yeah,
it's just amazing how resilient people are.
yeah. That's honestly awesome. I'm actually kind of glad you took that and like answered the way you did. That was really cool.
Yeah, I don't know. I always like when I think, oh, I'd rather lay on the couch tonight. I'm like, well, there's somebody that's fighting a lot tougher battle, doing a heck of a lot more than me.
Yeah, for sure.
So yeah, a little bit of a
Yeah, good
different
stuff.
approach.
Hmm.
All right, last question for you, because I feel like you're really good at this, especially with like building the JYT brand, the JYT family.
Okay.
Um, is just like, do you have any secrets for athlete retention? Like, how do you keep your athletes motivated? I know, this time
Uh,
of year it's kind of like
yeah.
happy out.
All right, I'm gonna give you a secret, okay?
Okay.
It's not about anything that I do differently. It's about attracting the athletes that you want to work with.
Okay.
So like I could take this in a couple of different ways, and like this isn't to like imply that like certain people are better than other people,
Right.
but like when it comes to this game that we're playing, is like as far as like athletes and getting better and things like that. You know, like I'm a believer that like winners win.
Yeah.
So like I'm trying to play the game where like I'm trying to help winners win more.
Right.
So I don't have to motivate them. They're already motivated people coming to me. I just help just take their motivation and their drive and just aim it where they need to go. Like I don't want someone like who's like a good athlete or like that's super motivated and they're like aim like they need to be going this way, but like they're aiming that way. I just want to be able to pull them back. Like, no, you need to go here. And in that way, like I don't want to be a motivator, to be honest. Like, I think I'm a pretty like self-motivated person myself, and like I don't I don't want to spend half of my day like trying to motivate people and like changing their
Right.
mind. Like I'm just sort of like, look, like if you want to do this, we're doing it. But like I don't want to have to like spend all this time encouraging you. Like sometimes like you have to redirect people by like giving them a reality check. Like, hey, like if this is really what you want to be, then you need to do these things. This is like what all the other elite people are doing.
Right.
And it's not that like I'm only working with like really high level athletes and like, or that's the only people I want to work with. Like, I really don't even care about like your athletic ability.
Right.
I just want to know that you're motivated and coachable and
Yeah.
fit into that category. Like, we could do this all day and we'll churn out results for you. But even if like you're a high level athlete, but you're not motivated or like you're not coachable, like I don't want to coach you.
Right.
And like 100%, like me and Tim have talked about, my assistant, like there's athletes that have not come back here who are extremely talented and they're like good at whatever they do, but they're just like hard to coach. And like when they
Yeah.
don't come back, we don't cry about it at all. So we just move on. And like, so I think like just building like your brand and like who you want to be is like that kind of attracts over time. Like you kind of like weed out like the ones that aren't motivated, but eventually like the people that know
Right.
and they show up here and they train hard and they get the results they want. And as a coach, like you could just focus on being a coach instead of a cheerleader
I love
and
that.
like having to like raw 'em and stuff.
Right.
Like, because honestly, we don't have time for that. Like, there's not enough time in a day to like have to motivate people. And like, I'm just trying to skip that step completely, to be honest. And if somebody else wants to do that, like try to like motivate the unmotivated,
Right.
you know, that's fine. But you know, that's kind of not the game that I signed up to play.
Yeah. That's
Makes sense.
awesome. I love that.
Yeah, I just like to just I like to have motivated people, you know, work with, and you know that way they'll stick around, and when they're motivated already and they get results, they like it and they want more.
Right.
So it's going to motivate them even more. So I think it's just kind of like a win-win thing there.
Totally. I agree.
Hmm.
Well, perfect. That definitely wraps it up.
Yeah, so we'll have to like do another one of these if you know if the people like this,
Yeah,
and
for sure.
you know we'll come up with some new stuff or try to do some more marketing things or informational things, I should say, for you know for our followers.